So you just now had to make some tough ranking decisions on the polling questions to choose what are some of the factors or aspects of treatment that would be most important to you. And those followed some questions that really helped us understand how well what you have now is working for you. And so what we want to do now is dive in deeper, just like we did this morning, and hear about those treatments that are most important to you, either because they've really helped, or maybe it would be also, I think it's equally important to discuss those things that have not helped so much. In either case, whether the product or approach, strategy, again, when we talk about treatments, we're being very broad here. We're not talking just about medicines, but also medical procedures, maybe medical devices that you use, like mobility assistance devices, canes, walkers, wheelchairs, scooters, and then even things we've heard about physical therapy, occupational therapy, exercise as being some other strategies. So how well have they worked? Maybe starting with those things that have worked the most for you, as well as those things that have worked least well for you. And anytime you talk and share an experience with a therapy, I want you to also let us know if there were any downsides to that. Was it pretty easy to utilize that strategy or take that product, whether that be the number of times you need to take it a day, side effect profile, the amount of time that it took. Is that part of the burden of taking that product, or was it relatively easy, whether or not the product actually significantly improved your symptoms and burdens of the disease? So I want to start out broad, although I'm going to try to work us through a lot of the different categories of treatments that we have. But I want to first see what experiences in the audience might be most burning, where you really want to share something that has really either worked or not worked, paint a little bit of a picture for us about showing us how that treatment did or did not work.
One of the requirements, I guess, for being on Crysvita was that there was supposed to, at least for my daughter, was physical therapy. And she went to one, and they actually hurt her. Mm-hmm. Again, illustrating the fact that they don't know how to handle XLH patients. So she was in bed 3 days on that one. So that was a non-starter right mm-hmm. there. So it was like, I don't know if they thought they were dealing with a football player or what. I don't know. Mm. But she crunched pretty good.
I just wanted to share two things that have been really helpful. I've been working with a personal trainer for the last 8 years, 3 days a week, and it's really been very helpful in terms of my strength and mobility. That's number one. And I treat myself now to a monthly massage to work out all the kinks in my body, and that's been very helpful too.
And what have been the impacts that you've noticed on maybe what you've been able to do because of these things?
I can get up if I'm taking a bath. I can get up from the sitting position in the bottom of the bathtub. And, my sister's noticed, a lot of, I call them baby exercises they have me doing and lifting weights, but it's been really, really positive.
Wonderful. Thank you. I don't know that we necessarily have anyone, but we did hear in our presentation this morning about TIO tumor removal. And so if anyone has any experience with that, we'd love to hear those experiences.
One thing that helped me tremendously for my stiff muscles, which is one of my major issues, is we have a hot tub. We live in Texas, so I can't use the hot tub in the summertime because the outside temperature is sometimes 113. But in the wintertime, using a hot tub and finding one that is not where everybody sits on the floor of it with a little bump for your seat, but rather where the seat is up, 8 to 12 inches from the floor, so that I can put my short legs down in the center and ride bicycle or what have you. It makes a huge difference in my flexibility for the entire day. And we have one that has jets where I can put my wrists on them or my hands, move them to where my back needs the right amount of pressure that day. It's just astounding the difference it makes.
It helps with the stiffness.
Yes.
Okay. Great, thank you. Is there any takers on the tumor removal? Either experience with it or maybe perspectives on having tumors and not having undergone tumor removal. I figure we probably don't, maybe Jim is our only TIO patient in the room, but wanted to at least put it out there.
I'm Jim's mom, and if you know anyone that has a tumor or that's having trouble with bone things, that just isn't generally connected. The neurologists we worked with were great. The endocrinologists we worked with were very, very helpful, but those two fields are not connected at all. So if you know of anybody, or just tell them to just keep searching. If they think there's a connection, keep searching, keep listening to little tidbits or ideas that your doctors will say, and then you kind of add them all up and you're thinking, well, these kind of match.
Yeah. Can you tell us a little bit about Jim's experience with tumor removal?
Well, Jim can probably talk more about that.
I have been through a lot. I had 2 tumor surgeries. On my second tumor surgery, this is when we all found out that I was really having difficulties before and after I had my surgery too. And we just need more information about like bone pain and like my osteomalacia. It's just not a whole lot information out there. I went through a ton of doctors, and they didn't know a whole lot of why I was having balance issues. It was very frustrating to me, and it's just not enough questions that you can ask your doctors, the questions that you need to, you have to answer. You just have to, it's just not enough answers out there, and they just don't know what is out there. So you can't just ask enough questions. I just put it that way, because I've been through a whole lot, and we need to have a lot more answers about my cases on TIO and tumor-induced that causes osteomalacia and rickets in your bones. And once they figured it out, I was happy that when they finally narrowed it down, but it took a very, very long time and stuff too. But I don't want to hold you guys up anymore, but I can just go on and on, but it's just not a whole lot of information out there, and on other bone cases also too.
Thank you, Jim.
Yeah.
No, and it sounds like your experience is actually quite similar to what we've heard a lot of in the room about not having all of the questions answered. And thank you for representing the TIO patient voice.
Yeah.
So we have a comment right here in the back.
Yeah,
Yes, Gail?
I obviously can't talk to TIO, so I wanted to go back to what Carol said about using heat therapy for relaxing muscles. And I think this speaks to the fact that there's so much variability across the patients, because I find if I use heat therapy, I get worse. I'll feel better temporarily, while the muscles relax and everything. but the next day I'll be in significantly more pain. And that's just me. I know plenty of people, like Carol has said, within our community that find that useful. But in my case, I have to use ice, which is great in the summertime, but if you're doing it in January or February in Massachusetts, it's not a lot of fun. But for me, it works longer term because it reduces the inflammation, because we're, of course, at more risk of arthritis and things like that is inflammation-based. So I'm just throwing that out there. I keep meaning to do a little survey someday on our forum saying, do you use ice or heat? And I have a feeling we'd end up with a 50-50 mix. But like I say, there is variability there, but that is another option.
One of the questions that are up there is basically there's no cure for our condition, what specific things would help us for treatment and options. I think what I'm learning as growing into an aging adulthood, I think it's so important to get the physical therapy and prevention of certain limited range of motions and how we can really impact the aging process. And taking for granted riding a bike, that's not an option for me anymore. So I think there needs to be more providers who can help the community and prevent those things as we get adults and understanding the manifestations of calcifications.
So can you tell me a little, mentioned that using physical therapy, has that been something that's been helpful for you? And can you
when I went through that horrible experience in my life, the physical therapy, I was still in the walker after surgery. I had rigorous therapy 3 times a week, even after the rehab facility, and without that and the continuous care, I wouldn't be where I'm at today. So physical therapy was a huge impact in my life.
Sure.
For the better.
Hi, my name's Tanya. I'm some type of spontaneous hypophosphatemia. We're not sure if it's XLH or a dominant case. Treated with phosphorus and calcitriol as a child, did well, went on and off treatment sort of through young adulthood. Actually made it through medical school and into practice, met my husband, had 2 children. But what I want to talk about is the burden of treatment. For me, I changed jobs, went to a new place, a smaller practice. My boss decided that Obamacare would be what we should have. And I live in a community where I had to choose a plan where I would either be able to see the practitioner across the state in Philadelphia or one that would not. So I chose the one where I could keep my practitioner that knew what was going on. But hence, Obamacare allowed them to put calcitriol as a vitamin after multiple times trying to work through the insurance industry, my senator's office, and even as a physician trying to talk to the CMO of the insurance agency who refused to talk to me. I had to change jobs to get better health insurance for my family. With the flux in the healthcare system, that has led to 3 jobs in a 26-month period. So just trying to get basic treatment has been a stressor on my family.
How well the calcitriol and phosphorus was working for you? Obviously, it was important because you were pursuing it and changing jobs even to get access to it. So can you tell us a little bit about that?
Actually, as a child, within 1 year of treatment, so I was diagnosed at 7, at 8, there were no physical signs of the rickets, and probably within shortly of that, the bowing had completely resolved. So for me, the calcitriol and phosphorus worked well. I had bone pain here and there. As an adult, had to go back on treatment, having to use both rails on a set of stairs to get up the stairs because of knee and muscle pain. But going back on treatment, I do a pretty rigorous lifestyle. I mean, there's like 3 days in a row I won't be home. I go from hospital to office and back to hospital. And I'm able to keep up. I've had to give up running because of some of the pain. And it's not the day of. It's actually pain the day after in joints and ligaments. But I'm still able to exercise on a regular basis. So for me, again, we can't tell what type I have, but the calcitriol has worked well. The calcitriol and phosphorus has worked well for my son, too.
I'd just like to say thank you to the doctors that have been so instrumental in developing this drug that is such a breakthrough. My daughter has had both back surgery and been part of that clinical process really has helped her a lot. It was too late. I mean, even after the back surgery and the clinical help with the monthly shots, she's been told now that her back is not operable by the spine people. And so she's got to live with being hunched over. And I just want to express thank you to the doctors for all the help they've been.
Yeah.
I'm so grateful for that.
Elaborate a little bit on the surgeries, and this goes into the calcitriol and KFOS treatments as well. As I mentioned, I've had parathyroid surgery. First one, they removed parathyroid gland, left a small portion in my neck, and did the implant into the arm. The second time I had to have parathyroid surgery, they were thinking it was going to be the one in the arm, but it was actually the remainder that they had left in the neck that had enlarged again. So they went in and took that out. So the only remaining parathyroid I have is now in my left arm. But that, has to do with the KFOS and the phosphates, calcitriol. But, we think of our bones as being soft. But I've had surgery on both of my legs, tibial osteotomies. And the first surgery I went in, they had planned to do both legs at one time. It was supposed to be, I think, a 3-hour surgery. I ended up in the operating room for 6 hours. They only got one leg done. The rod jammed up shortly above my ankle, and they had to go in and cut the ankle to finish driving the rod out. And they told me after the fact that they broke 4 saw blades and 2 drill bits during that operation. And they said that the bones were extremely dense and extremely hard, at least in my case. So I'm guessing that is an indication of how well the calcitriol and KFOS worked for the bone mineralization, at least for me. The other leg they went in and did with a plate at a later date, but I, after being under the tourniquet for so long, that first surgery developed compartment syndrome in that leg, and actually came within an hour of losing the leg. The swelling reached that point. Ended up with 5 surgeries over the course of 9 days to relieve the pressure, and then go back and have the wounds closed up, because of the amount of swelling that was present.
I have 2 questions for the room. First, regarding surgery, I had the spinal stenosis surgery maybe 5 or 6 years ago after needing it 3 or 4 years before that, but didn't want to do it till I couldn't drive. And now all that pain has come back. Is that happening to people? You have spinal stenosis surgery, then it gets better, then it gets worse again, and you're repeating the surgeries? Has anyone been through that?
Seeing that heads nodding around the room, yeah.
Okay. And then the other thing this is a little unrelated, but I haven't heard anyone refer to this. In my 20s, my jaw quit opening. I got TMJ, and I've wondered all these years if the TMJ is related. I've always assumed it was, but I haven't read that anywhere. No one has mentioned it. Do other people have TMJ? Yeah, how many people?
Show of hands on TMJ.
Not very
Jaw
many,
stiffness.
actually. Okay.
So,
All right.
some number.
All right, thank you. That's it.
Hi, I'm Caroline. I'm going to stand so everyone can see me because we're short. 26, so kind of repping the kind of younger adult generation. As far as surgery, so I had 3 surgeries to straighten my legs growing up. I had pretty severe bowing. My orthopedic surgeon said you can picture it like the McDonald's M, like your femur goes like that, and then at the knee it goes like that again, which I think can be a little different from what some other people experience. So I had the spatial frame to straighten my entire left leg when I was 5 years old, and then in 5th grade, we did lower left and upper right, and then in 6th grade, lower right and upper left. And then I stopped growing, so they haven't rebowed again, thankfully. And then in high school, stopped taking the phosphorus and calcitriol because no one really said to keep taking it. They didn't say to not take it. No one really emphasized anything. So after college, probably a couple years ago, got back on meds. I live in Houston, so we have Dr. Rupia was there, so that was really great to meet her, which has really affected, my rickets is like a lot more chill when I'm on meds and like is a lot less painful. But just kind of in general, and I know this is kind of being talked about in community, but would love to see more emphasis on educating like the teenagers kind of coming out of surgeries and out of pediatric care and then going into young adult care and learning to take over your own care and really emphasizing that it's important to keep taking care of your body because we do change, and hearing stories of everyone who's older than me and going through a lot, and I'm taking notes from all of y'all for my own future. It's important to stay on med and kind of educate our younger generation for their future.
We've been talking a lot about your experiences with what treatments, broadly defined, you currently have, now kind of fully extended into the future. We've been talking about all day really in the past and your experiences, but I want to know a little bit about your preferences. You're in a community, you heard Dr. Kemp say, in some ways, you're at the cutting edge. You're in the 5% of rare diseases that have an approved treatment, but we also heard from Susan that the burden of the disease is shifting, and there's still work to be done. We've heard that over and over throughout the day. So I think it's important that we make sure that we address this before while we have this opportunity. So the question is, short of a cure for your condition, what specifically would you like from the next future therapy? And so this can be really described however you might like. It might be some improvement in a symptom. It might be related to your disease progression and whether you would like to see that be slowed, stopped, even improved upon, reversal. It could even be more broadly defined in terms of how activities that you would like to be able to do more of or do more fully. So there's a lot of opportunity here to kind of really build on everything leading up right to this point and communicate what it is specifically you would like to see short of a cure from your next therapy.
I would like to see in the future that a way to control the enthesopathy. It seems to me to be very debilitating. I'm seeing it particularly in my daughter with her elbows won't extend any more than this now. And apparently her longitudinal ligament posterior is being calcified, ossified, and she's being pushed forward to the point where she's like this. And she was my height, and now she's down to about here. I don't know how much more she's going to lose.
In new treatment, if we could this may be an impossibility because of the extent of our illness, but if we could just see some degeneration or regression of our symptoms, that would just be it would be something that all of us could appreciate. If we could gain some height, if we could have our teeth just want to stay in our mouth, if our hearing could come back, so many things, just some regeneration of the symptoms that we had. That's what I would like to see. Not that I'm not thankful for the treatment that we have now, but absolutely, if we could just have regeneration or restoration of what we've lost already.
When my sister had her knees replaced in Phoenix, we heard about a process called ARP wave technology, that in 2 weeks, one of her knees was just tremendously fast healing. And part of the gentleman who helped us with that was, he said that if you continue this on an ongoing basis, it would redistribute, because it stimulates the muscles and makes them work, it would redistribute the blood in such a way that it takes away the calcium buildup between the bones. The question is this not an area that maybe we could explore, the use of electro pulses making the muscles work more, that makes the blood flow and maybe gets rid of the deposits of calcium?
Sure.
I don't know if that's a valid thing, but I thought I'd ask.
Yeah, good to throw it out there.
I think it would be really helpful to see future treatments that encompass a lot of the related or, I don't know, like comorbid conditions that go with this. I know many of us have talked about having osteoarthritis. For me, and that's a particular challenge, and it's hard to know where my joint pain is coming from or if it's coming from both things, and then manage the complexities of medications that address one or the other. But then I've had issues with liver enzymes being elevated and things like that. And so it's just such a big balance between different physicians, different, treatments and all of that to figure out what's coming from where and how to control all of it without it interfering with one another. So
One more thing I'd like to add, we need better pain management. My pain is much better now than it used to be. I have found in talking with people that have XLH and from my own experience, pain medications, for one reason or another, don't work well for us. Things like morphine, hydrocodone, fentanyl that would treat pain for a normal person. It seems like, I don't know if we burn through the pain medication faster or, some of us have had so many surgeries and been on so many different treatments that maybe we've just adapted. But there needs to be some investigation, number one, into why the pain medication doesn't work for us and how to find something that does work. It's not that our pain is so much worse than other people's. I think a lot of times it's just incredibly frustrating that you try stronger and stronger and stronger pain medications to the point that you're walking through life like a zombie and it doesn't do anything for the pain.
How would you define, successful treatment of your pain? Is it some activity that you could do? Or is it how would you describe that?
Well, in my case, when my pain was at the worst, it wasn't like constant. It would be a certain movement would trigger just terrible pain, or when the spinal stenosis reached the point where I roll over in bed and it triggers, massive back spasm, or almost caused my dad to have an accident one time. We were driving to a doctor's appointment in Houston. I was asleep in the passenger seat. We hit a bump. Well, hitting the bump in the car triggered a massive back spasm, which woke me up with a scream. And of course, he jerked the wheel and went across 6 lanes of traffic in the middle of downtown Houston. But, that's finding something that would ease that pain or prevent that, and some days, you have just a general pain. Like I was telling somebody earlier, I don't know if it's bone pain. I don't know if it's muscle pain. I don't know where the pain is coming from, but, this hurts or that hurts.
Sure.
And nothing would stop it. Even when I was on the 0.75 microgram per hour fentanyl patches, those are supposed to last you 3 days. I would get about a day and a half of marginal relief, and then I'd have to go through another day and a half of withdrawal symptoms before I could change the patch, because I could only change them out every 3 days. And you'd go to the doctor and you try to explain this, and they treat you like a criminal because that level of pain medication should, put a horse to sleep.
Sure.
And it doesn't do anything. Well, you're just wanting pain meds, So that's kind of one of the areas that we need to look into.
Well, just to speak to your comment on pain, yesterday the House and the Senate passed the H.R. 6 opioid support bill, so we can kiss chronic pain management goodbye. The president's going to sign it into law this week. It's further going to punish chronic pain. So what do we want to do about that?
This concludes what we really set out to do today. I know it's been long, very personal, definitely emotional at times. From my perspective, you all did what Susan asked you to do from the outset. You lifted the curtain, you spoke your truth, and I just want to thank each and every one of you for rising to this occasion. You know, for me, I definitely witnessed each and every one of your courage, each and every one of your perseverance. I've certainly got to peek behind your curtain as someone that's an outsider to this community, and it is incredible what you experience day in and day out. And if you didn't speak it today, it would not have been heard. So it's truly been my honor and privilege to have a part in what I think is a very monumental day for this community. And I just want to thank you again for letting me be part of that.